Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Areas where people kind of brush it under the carpet, they kind of keep it a secret. It's one of those areas I think people are maybe ashamed of. The idea, or I have a family member who's got depression. A lot of people don't understand it. My experience is that, people with depression some go to a psychiatrist and get medicine, and psychiatrists, that's what they do. They prescribe medicine, and it's that's a whole bag of worms right there. Who's prescribing what kind of medicine for which of these different kind of depressive disorders? And people who stop using drugs get depressed. So then people who stop drinking and drugging want to take something else to keep them from being depressed. So it's kind of a never-ending cycle, but it is real, and it's nothing to be toyed with. It's nothing to be played with. This is a very serious and real disease. Depression is really something.
How many of you have been associated with people who kill themselves?
Yeah, I've had two of my students commit suicide, former students.
First time I really remember hearing about someone committing suicide and getting caught, blamed on depression, or that was the diagnosis, was when the representative in DC, John Wilson, who now the Wilson Building is named for, he was running. I lived in his district down in Southwest at the time, and he had just campaigned maybe a day or two in my neighborhood, and we saw him and talked to him, and then less than a week later, they said he had committed suicide because of depression. And that was the first inkling really that I had. And that's when I started looking at it and listening. And since then, it's been several other relatively famous people who have committed suicide. So it strikes everywhere, and it is something serious. Yes.
I was talking with my brother the other day about depression, and it's a sense of hopelessness where you don't see a way out. And we have a lot of sometimes in everybody's life, you come to that point where you might be depressed about something, but it's getting that hope and thinking that you would do something about it. Because we were talking about somebody that gets that they have cancer. It's how they treat it mentally, that I got hope that I can go through this, or my faith in God, or I'm going to beat this or something, rather than a defeatist attitude. And he was joking the other day when he was talking about how many people like to cuss, but that's one way of getting that somebody does something to you. And rather than get depressed about it and internally hold it in, whether you do it verbally or something, you do something so you don't get depressed by how that person is controlling you and you feel hopeless helpless without being able to do something. And I notice a lot of times when someone is actually doing something to me or putting me in a predicament, and when they say you shouldn't ever give anybody a piece of your mind, but you should talk up and release those emotions. And whether they do anything about it, at least you don't internalize it and get depressed that they have just messed all over you and you were set by helplessly not being able to do anything about it. So whatever you do, be able to release it. And even in our churches, sometimes we were able to release it by just going to church screaming and shouting and everything. But now we're just quiet and we internalize this. We become depressed and have no channels of releasing all of this stuff that is piled upon us. And life, when it hits you, it just hits you. And when you start internalizing it and have no way to release these sad feelings, then you become depressed even more. And everybody, I think, can become depressed at sometimes until you learn how to release that stuff.
Absolutely. Yeah.
Because becoming depressed is not the problem. It's maintaining that depressed state, as you said, not having any hope at all. And of course, I think Mark talked last time about the pain. We talked about the pain of depression, how it hurts.
Yeah.
And sometimes people think that they can get rid of that pain by killing themselves. So it's a serious problem, and stigma is part of it because people don't want to go to the psychiatrist. Sometimes they don't want to take the medicine because the medication makes them feel bad. So it's a tough disease, and it's becoming more and more prevalent as we become more and more isolated. Hopeful that as we get back to the so-called normal state, we'll be able to decrease the rapid rise in the African-American community.
And also, Dr. Callender, yesterday, the guy who went on rampage of killing in California, they said he had bipolar depression. He was a white man, 56 years old. His ex-wife, the Chinese lady, she said he talked about killing some of his coworkers and all that. And we don't know if he got the treatment for bipolar depression.
Yeah.
You know, one of the things that I learned from my experience with, you know, knowing someone who committed suicide is the ability to listen when somebody shares that pain and recognize that's the point. This kid came to me. He was in college, and he came back over to Kelly Miller and sat down after band rehearsal and talked. You know, he was in a lot of pain. His girlfriend had left him, and she was pregnant. And, you know, and then, you know, I sat there and listened. We talked for about an hour, and like 2 days later, he hung himself. So the ability to listen and recognize that pain and hopelessness that somebody might have can also help them if we act quickly enough, you know, to give them help and hope.
Because the one thing that you can do is to try to go with them to the hospital to help them get treatment.
Yeah. And, you know, last week, Janice, are you there?
Yes.
Yeah. And that's what you were telling 2 weeks ago, just now what John said, is listening to them, you know, to get it out of their system, you know. That's what you talked about.
Absolutely. Whether it's a relative or an acquaintance. And sometimes you can pick up on an individual's mood. And if you see them being withdrawn, and sometimes you even know that they've gone through something traumatic, talking to them will help pull them out. And mainly is getting them to talk.
Right.
Well, you can talk to them, but you need to have them talk to you and express their feelings. And sometimes it will make them feel better.
Yeah.
But I think you're forgetting what Dr. Callender just said. Listening, John Buchanan just said, he listened to this student and they went
Right.
out and killed themselves anyway. You can talk to them, and unless you know the right thing to say and how to do it, and even psychiatrists will say it'll take years and years, and even with the treatment with this. And that's why there's so much high suicide among some psychiatrists. Knowing the right thing to say and how to listen. Yeah, they taught themselves into killing themselves even more. They taught themselves into more of a depression than when they first started off, because they just practicing and reiterating all these down points of their life. So unless you give them some hope or something, I mean, listening is really nice. But Dr. Callender just said, you got to put them in the way of getting professional help or somebody that can actually help them. Because I know I'll listen a lot. And I'll say, oh man, they're depressed, they're on the deep end. But I have no idea what words is except for encouraging. And Maya's real good in encouraging others and uplifting. But sometimes I just don't know that right thing to say. So I need to know what to see,
Right. And I agree with you 100%. I had a situation like that of a family member that was very depressed.
Yeah.
And sure, you can say, go, 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 but you have to bring them into some source of sort of realization so that they can think, maybe I do have a problem. Because they're depressed, they're not going to say, I'm depressed.
No,
if you pick up on it and if you talk to them, and what I told this individual, I am not a professional. I can listen to you and I can tell you how I feel, but I really think you need to go talk to someone. You need to go to a professional and explain how you feel. Long story short, that's what happened. That individual went to a professional and continues to see this professional that has helped the individual through a lot of dark days. I agree with you. We're not professionals, but you don't overlook it.
No.
You try to help them. You talk them through it. You hope that you say one thing to make them realize, maybe I do need to talk to someone. And that's what happened in this particular case that I'm referring to. And it was a family member.
Yeah.
And Janice, you are blessed because you only have one family member. I can think of 5 right now off the hat. So I got a mission to do. You only got 1 and we got 5.
Oh no, I said this particular one.
The other thing is that, like Dr. Callender said, depression is not one day or 2 days or anything like that.
Right.
It's a long-term situation, and which means that during that long term, the person could commit suicide along the way at any one of those points. So that's important to remember.
What I would say in closing is that we don't have what it takes to help many of those people, and so we have to take them to help. And so
exactly, yes,
actually
we don't.
Suicidal, you may have to walk them to the hospital, to the emergency room.
Yeah.
Because many people will tell you, I want to tell you this in confidence, but when they tell you that in confidence, you need to take them to help, because sometimes they won't help. And then there's suicide telephone numbers that they can talk to. Also help. But I think the recognition that we aren't the experts and that there are experts who can help them, maybe we can take them there as quickly as possible.
Dr. Callender, I agree with you 100% because it happened in my husband's family just now. His cousin, she's 62 years old, and we didn't know anything. Last month, his aunt called and said she's married, has children and everything, grown children, and that she had been drinking all this, and her husband, children, nobody knew this, they said, for more than 40 years. I don't know how they can escape that. But anyway, now she's got kidney failure, liver failure. And the doctor said she's going to die soon. And if she doesn't, get both the transplants. And she's now they put her in the hospital yesterday. And so you're absolutely right. For some reason, she was very depressed because she was raped as a young girl. And that played a role, and she kept drinking all her life. We just learned about that. But I don't know, her husband didn't pick up. He said, I didn't know she was drinking, he said. So now she got, look what it's leading to, death, you know. So you're right, you know, got to get the professional help.
Do suicide hotlines, do they work?
Yes. We believe they do. And that, if you can't get them to the hospitals, get them to a suicide hotline. I have a friend who was on that hotline, and she talked about how it has been helpful to get them to go to get help, because if you can get them at least to do that, that's a positive step.
Dr. Callender, can you move your camera down a little bit? We can only see the top of your head.
If he does that, he'll back away from the microphone, and that's not the best situation.
Okay, can you see me better now?
And
Yes.
you sound better. You can't hear you as well either. You sound better now when you pull away.
That's
Actually.
This is my other computer, which is problematic.
Yeah, he's using a different computer today. And the microphone, he has to stay closer to the microphone.
Yeah. But I'll try to stay close to both. Okay, this is an interesting article that points out mental health situations have worsened. Now, one thing that we didn't talk about is that it affects teachers too. And many of you are retired teachers, so you can understand that might have some comments about that. Because we always talk about the mental health of the students. We rarely talk about the mental health of the teachers. What are your thoughts about that, teachers?
One thought I have is that there are several professions where suicide is semi-common. And as you're saying, one of them is the teaching field. The other is the policemen. And there were certain type of doctors. I don't think it was suicide. I mean, they weren't psychiatrists. It was another type of doctor.
Anesthesiologists.
Yeah.
Access to medicine.
Right. So yeah, in the profession, but back to teachers. Yeah, I haven't experienced any teachers. Carol stepped away, and maybe she knows. John, you could weigh in on if you know any teachers.
Yeah, I talked to a lot of teachers, but yeah, it's tough. I mean, you know, all across the board, not being in touch, but also some teachers haven't been able to get paid. You know,
Yeah.
some teachers who have to or would normally meet in person. Some types of education cannot be done from a distance, like a chemistry lab or a biology experiment. You know, you have to have in-person contact, and you know, so I really don't know. It's across the board, but this article is talking about mostly about the students who are now you know, caught up in the controversy. I mean, they feel frustrated and helpless, you know, whether they're going to go to school, whether they're going to get their free lunch, you know, at school, or whether they're going to see their friends. It's really a big deal. Now, I'm glad this article is highlighting, you know, the effect that the pandemic has had on these children.
Yeah, and that's why so many people want schools to be open again, because of the mental health issues that become evident in kids killing themselves, as well as just being depressed. And so many parents recently have had their children seeking psychiatric help because of the depression associated with the isolation. Now, I know Carol has talked about the fact that, well, even when you open the schools up, will that help? I think it will help. The question is, how do we open the schools, and do we do it in a fashion that allows us to overcome the isolation that existed before? Do you have any ideas or thoughts about how they should do that when they open school this fall?
Okay, I have a question. Okay, we got the vaccination out. It's going down. So what are the parameters? Why can't we just open up like we used to do?
No reason. After the metrics that you mentioned are the ones that should govern. And when they reach that level that you're talking about, where we don't have the infection anymore, then there's no reason why we can't. So it might be that by the fall, August, and that the numbers will be so low that it'll be okay.
I think the
Okay.
problem is those families who, like we talked about earlier, who refuse to get vaccinated. You're going to send the kids back to school. You know, if there's no safeguards, or you know, like the other kids, you have to have the diphtheria, the tetanus, whooping cough, all those shots. You know, is there going to be any way to determine whether
Right.
the students are going to have their vaccination
Yeah.
for COVID?
Good idea.
Yeah, but that's all just promoting fear. They're telling the churches that they could open to full capacity with masks on, and the churches are now very leery. Okay, we'll open up with 25%, 15%. The churches don't want to open up. The people don't want to come back because now there's a fear, and they're saying it's okay, you can do this. And now the people, they're saying it's okay to go outside without the mask. Okay, yeah, but I'm still going to take precaution and wear it. So how long will we live in this state after they say everything is all clear, everything is okay, but people still be living in the fear?
It may be, but it'll take time because what you mentioned is the psychological aspect of it. It does not disappear overnight. And so you're right, it's going to take time. It's something we really have to work on because the mental health issues are huge. And if we come back with the fear to talk about, they will remain huge. And I think when we get to the point where we have virtually no new infections, and we have nobody dying, then eventually that fear will be replaced. Because you're right, because you don't push a button and the fear goes away. It's something that's going to take time. However, in the meantime, the number of young people have died, gone, committing suicide and other things. So the sooner we can get back to that situation, the better. But you're right, it's not something that happens overnight. Next week I have one of the psychologists coming. He's going to talk about what the program she's implemented in the school to try and address some of these mental health issues. The athletes who've been impacted by this as much or as more than some other issues because athletics have just about been stopped. And those people who might have been able to get scholarships because of that, they no longer are going to get scholarships. So they're depressed as well. So it's a vicious cycle that it's going to take a while to get over. It's something we have to work on.
I have another question. I was watching, because my son was watching it, this basketball game, my husband too. Now, they got all these players out on the floor without a mask, but the people on the sideline got the mask. I don't understand that either.
Well, it's changed now. If you looked at the game last night, you see that the fans, they actually have segregated it so that you have people who are vaccinated in certain sections and people who are not vaccinated in other sections. And the people who are vaccinated don't have to wear masks. And so hopefully we'll get to the point where everybody will be vaccinated and nobody will have to wear masks.
Okay, but I don't understand why the guys on the floor don't have the mask on and the people on the around on the sidelines have the mask on.
Well, I think,
don't forget those players. They get tested every morning at 8 o'clock every morning.
Oh.
Well, all of them are being tested. So why, when you sit down, you gotta put a mask on?
I don't think the whole staff may be getting tested, but the players are.
But the players, once they sit down, they put this mask on.
Well, I think that's going to change as everybody is vaccinated. But right now, it is, and I think there's an article on that about the fact that the CDC saying you don't need to wear masks is being used by some and not by others, and that's causing confusion. But the CDC is suggesting that you're vaccinated, you don't need to wear a mask. That's not true in every state. Some states do, some states it isn't. And that's why, but what you're talking about is the confusion and chaos that exists because in some states, if you go to the basketball game, they don't wear masks. In some states, they do. But it is confusing. Now, this is an article that was presented because the issue of myocarditis in children will be coming up, and apparently it has occurred. Myocarditis and myocarditis, and they're saying that yes, it is occurring, but that it is not something that requires hospitalization. It does cause chest pain and may cause shortness of breath, but it doesn't seem as though it's something that is causing people to require hospitalization like that. But it is something that is occurring. 1 out of every 100,000 kids is not common, but if your kid is one of those people,
Dr. Callender, some of these articles are what's causing fear.
Yeah, yeah.
well, of course, the question is, do you want to have accurate information released, or do you want it forbidden? I think it's better to have it out there. But I don't disagree with you. Yeah, but knowledge sometimes causes fear, but it's better to know the facts and then not to know.
Another example was the article about blood clots. Even though the results were minuscule, it's those kinds of things that causes fear.
That's true, but it's just important to let people know what's going on. I think you need to educate them, and that's part of education. Just let them know that yes, this is going on, but it's minuscule. And you don't want to hide it because people will come out with it anyway. So, but you're right, that's what's the effort.
And the main thing that needs to get out to the public is that everything is not perfect.
Right, right.
Absolutely.
Yeah.
And I think it's important to get out that yes, these things occur, and you're right, and that but they are infrequent. Just as you see one article that talks about some people who have been vaccinated come down with coronavirus. So the question is, do you want that information released? I think it's better released and educated about than be hidden.
You got a good point there, because I think the incident out in Wuhan, China was kept secret.
Yeah.
Well, everything in China was kept secret. I think your daughter expressed it well when she said that there's really no freedom for anything in China. So you can't speak, you can't do anything. So they hid everything in China, and we're learning they hid even more than we suspected. And one of the articles will address that as well.
I would rather know about this information and be afraid of knowing than not knowing and be afraid of the unknown.
Formed fear.
Yeah. Oh, yeah, the hesitancy in the younger generation is something that they're addressing as well. Just as they're addressing the issue in the African American community, addressing it in the younger community where different novel approaches, including what you mentioned in terms of the financial incentives. And I think it's all about trying to make sure that as close to 100% of Americans are vaccinated. We'll never get to that. But if we get up to 70%, that may be enough for the so-called herd immunity to protect those people that Janice was talking about who we protect by being vaccinated. So that allows them to not take the vaccine and still not be infected.
It seems as though different areas of the country, and I'm thinking about our area now, where because so many people in Maryland say are vaccinated, they're opening up and treating it as if it's herd immunity. Is that the correct way it should be done, or should we wait until the whole country? Or
well,
I think that's some of the hesitation with people too.
You're absolutely right, but 70% is the goal that we think we should reach in order to get herd immunity. And if in many of these communities or states or areas, they think they've got close to 80% of people vaccinated, so they think it's okay to go forward with it. And that's the danger if they're not correct. And all of these places are opening up with the presumption that we're going to have herd immunity. And that's the fear. That's an issue. You brought up a very good point. And that's why, for example, in different states, you have different rules and you have different infection rates in different states. So what applies in one state may not apply to another state.
Also, a point that some of my Republican friends were talking about: state control or government control over the individual. At a certain point, it was really necessary to have that kind of safety control with mask and distancing and hand washing and all that. But the sooner we get out of the government control of that, I think people may, decide on their own that this is safe for them, and they'll adopt those behaviors, safety behaviors on their own. But like where the city might say, okay, you can't have, you don't need a mask, but the business, the hotel or the restaurant might say, well, you have to have a mask to come in here, or whatever, whatever the business is, the grocery store, whatever. That gets the government out of the control and the individuals into control.
Speaking of the government, I don't really understand how this became this coronavirus thing became a Republican or Democrat issue. I think, Trump may have started that. Trump.
Exactly.
Without question, no doubt. Now, this is a interesting article. 2.8 million sign up because of the $1 million lottery in Ohio, which you mentioned earlier. And it works. Money works. Money works. It's interesting. Maryland has it now.
Yeah.
And you may find it in DC because of the tremendous lack of African American vaccinations.
We really need it in DC because of the fact of what percentage of Black people have coronavirus.
Yes, yeah. Seems to me that that's the next step for DC. Yeah. But this is impressive. I think when we first mentioned it, somebody said that this is the way to go because money talks, and I guess there's no question that they're around.
You forgot.
Airline joins, interesting. I guess they want to sell that middle seat. Huh?
But listen, 1 year of free flights. Does somebody want to go somewhere every day?
Yeah, a lot of people do.
I do. Yeah, give it to me. I have a lot of places I want to go. Free.
Yeah, that middle seat has been gone.
Middle seats.
And Buchanan wants to go do his snorkeling.
My scuba trips. Right?
Scuba trip, that's right.
Oh yeah.
That's interesting. So, well, we'll see which works the best, or if they all work, wonderful. Because the goal is to get as many people vaccinated as possible.
Black people need the money too.
I think, yeah.
They've been keeping the money away from us.
Well, one of the things that is going to happen is that I saw the case where one of the patients in the hospital got coronavirus in the hospital, and what that's going to do is going to require hospitals to ensure that all of the staff are vaccinated, and that's going to be interesting to see how that comes to play. Because if your staff is not vaccinated, they could spread the virus in the hospital. So just as for the flu, it's mandatory you take hepatitis vaccinations and flu vaccinations. So it's interesting how colleges are requiring vaccination, and now other places are requiring vaccination. And I think that by next year, many places will require vaccination. What are some of your thoughts about it?
I think that's a great way to get people to take the shot. If they want to go particular places, they'll get vaccinated, whether they really want to or not. The fact that they want to go or fly, or just like Ms. Robinson said about her grandson going to school. He knows he has to have that shot to go to school. He's going to get that shot. So.
Or he won't go to school.
Won't go to school.
What do you think of police when they stop you when you're driving? You have to show them. It's required that you have to show them your driver's license if they ask for it. What about if they stop you and they ask for your driver's license and then they ask you to show them your vaccination card?
But the vaccination isn't required to drive a car. You have to have a license. So we haven't gotten to that point yet that it's a requirement. Everybody has to have a vaccination so that you can have a card to show.
Yeah, that's what I'm talking about. Like an ID card. I'm thinking that in the future, maybe they'll pass a law where it's going to be required to carry around your proof of vaccination.
Hopefully not.
Thinking of cars, John, I remember years ago when they first started with the seatbelt law.
Yeah.
I had a claustrophobic fear of wearing my seatbelt. But after getting stopped once by the police, my fear went away. I used my seatbelt. So we do what we have to do when the time comes.
You have to show your proof of auto insurance.
Yeah. Yeah.
So they could pass a law.
No, they cannot.
It won't happen right away.
No.
Then you see more of the Republican Democrat issue come to play.
Yeah, but it's just like when our kids are born, we know they have to get those shots, and we do.
Yeah.
And it's the law for them to go to school. So certain places, certain things, it may not be the law of the land, but it will be the law to do certain things. And if people want to do those things, they'll abide by it.
Right.
Well,
but a lot of healthcare workers, doctors and nurses, especially, and in nursing home employees are afraid to take this shot, they say. So I don't know.
Yeah, well, I think it's going to be required by the You're right, it's a problem. Because that means that you could get the coronavirus actually in those institutions because the people were not vaccinated. So I think by next year, I bet you many hospitals are going to require their staff to be vaccinated.
I know that song.
I know.
What is it?
Yeah, look at that in the park. Have you seen that? Most people are not wearing masks anymore, or what have you seen as you go around?
Out in the street, most of them aren't. A few still are, if you're outside.
But they said if we're vaccinated, we don't have to wear them.
Right.
Well, I still see quite a few wearing them.
Yeah.
I've noticed that in my area, they still wear them.
Yes.
There are some, because they didn't want to do it anyway. There are some that don't wear, but the majority that I'm seeing still have their mask on.
Right, they do. Because you don't know who's vaccinated and who's not. I'm going to wear my mask. I don't know who's not vaccinated.
Well, if you're outside, it's not that big a deal. But if you come inside, definitely, I'm going to have a mask on.
Yeah, I'm just afraid. Inside, outside, I'm going to wear my mask. Of people.
I know. I continue to wear my.
I'm sorry. Go ahead.
Oh, I know. I continue to wear my mask because of not knowing who have been vaccinated and who have not, and because of the pollen. I find that I feel much better as long as there's a medium to a high pollen level with the mask on.
Right.
Yeah, I'm gonna still wear my mask outside. I don't want the cicadas to fly into my face.
They fly everywhere, boy. Yeah. So
there's a lot over here in my house.
I had one attack me while I was walking yesterday. It landed right on my chest there. But a buddy of mine sent me an advertisement for this restaurant is selling chocolate covered cicadas.
Yeah.
High in protein.
Several of the newscasts have their people eating cicadas on while they're doing their newscasts.
Really?
Chocolate covered cicadas. They can have them.
I had barbecue crickets, but not cicadas.
That's just as bad.
And they say you have to be careful being under the trees. Obviously, if you're in a area where there are a lot of trees, of course, they like the trees. And they were doing a report this morning and it was very hot. So the reporter was standing under a tree, but he felt the droplets from the cicada, but it was body fluids.
They urinate. Yeah.
Wow.
Yes, they'll urinate on you.
Right.
Oh,
Well,
I don't think that's urine.
Hopefully they're not carrying around the virus.
now
yeah.
they don't spread disease. That's one thing about it. They don't.
Okay, well, that's good to know.
They
Not
also
yet.
had a report about a lot of, I forgot what vicinity, but they're finding a lot of birds that are dying. And they're trying to figure out if people trying to kill the cicadas and putting insecticide and the birds are eating the cicadas and
Oh,
they're dying. It was on the news report last night. They haven't determined what's killing these birds.
oh my gosh.
Yeah, it's in this area too, Carol. I saw that report.
Oh,
So this is a hopeful sign that we're getting so many doses.
yeah.
Of course, we have a population of 350 million, but we don't know how many of those people have received full vaccination. Many of those probably only received one dose, and some of them they need to receive 2 doses. So, but anyway, still hopeful that by July 4th, that's what the president's target was, that we'd have 70% of the country to be fully vaccinated. That's a dream, but you know.
2 days ago, they were saying we were at 50% of full vaccination.
That's nice. That's good. We're getting there, slowly but surely. But we've got, what, 51 states? And it's interesting how that the other part of it is what percentage of people are not covered by the vaccination. And I guess there's one of the articles on that subject. I have not seen a recent article addressing the subject we talked about, which was why healthcare providers have such a relatively low percentage of people being vaccinated.
Yeah.
Because that is problematic.
It is.
That the hospitals rarely have more than 60% of the people on the staff
Yeah.
are vaccinated, which is not healthy.
Maybe they're suicidal.
I don't know. I think a survey is overdue. It's time we addressed it. At first, it was a kind of surprising result to see that so few people were vaccinated among the medical staff. But now we need to know why and take steps to overcome that.
And yet they're telling the patients to take the vaccination and they won't take it. So that's a bad example.
Except that those people are telling them to take the vaccination are vaccinated. If there are people who are not telling them to, but and it's true among physicians as well as nurses.
Yeah. And in the nursing home where my sister-in-law is at the Hebrew home, more than 60% of those nurses and nursing assistants have not taken the vaccination. At 100% of all the patients there, they got their vaccination.
Yeah, that's sad, isn't it? Yeah, that's something we have to deal with and overcome.
Is anybody having any idea why that is?
Yeah, that's what I was saying. I haven't seen any studies, any recent surveys to give an answer. Yeah. I'm sure they'll be forthcoming, but we need to know that. It's very important.
You know, Dr. Callender, a patient can refuse to accept care from a doctor or a nurse who's not been vaccinated.
Oh, they can?
Well, how would they know?
That's what I was gonna.
Right.
They wouldn't know.
Yeah.
They wouldn't know.
Is there any real risk on the patients if the patients have been vaccinated? Is it really a real risk that the caregivers have not?
Well,
Is it risk for the patients I'm talking?
Yes, if the patient has not been vaccinated, you mean?
No, if the patient has been,
Oh,
just like and the caregiver has not, is there a real risk for the patient?
Minuscule.
That's what I thought.
Dr. Callender, can a patient ask the doctor and the nurse, have you been vaccinated if you're in the hospital?
No one's going to ask.
Huh?
Of course, you can ask. That doesn't mean they have to answer. They don't have to answer. They can say it's none of your business.
Oh, no.
Wow.
Isn't their business. But anyway,
but if you've been vaccinated,
you can always ask.
Yeah.
You can always ask. And somebody may tell you. Many people will tell you that they're not vaccinated.
This next article is the scariest one right here.
What?
Well, actually, it's not that scary at all when you think about it. But it's
what is this?
It's so. Here's what it says: that 10,000 people had breakthrough infections.
Oh my!
What it doesn't say is that millions of people have been vaccinated, and we know that the vaccine is 95% effective. So that figures that 5% of people would not be vaccinated. Who've been vaccinated would not have takes. So it's not alarming, but it's good to know that even though you've been vaccinated, there's a certain small number of people who can still get the infection.
And once they have that infection, they could give it to someone who's not vaccinated, right?
Oh.
Yeah, right. And what happens, the CDC, because the number is so small, decided that they would stop worrying about it because it's rare. Because when you think of 10,000 compared to the hundreds of millions, it's wonderful. Because no vaccine is 100% effective. But immediately the best one, that's 97? Yeah. So the breakthrough cases do occur, and the majority in women. And so in many ways, it's here again, it goes back to what we were talking about before. Would you rather know that or not know that? I think you would want to know that this is where it is, so that you don't have any false rumors going around. And I think I read a more recent report that CDC plans to discontinue collecting information on breakthrough cases because it's so uncommon. Now this is an article that is causing people to be concerned because they realize that the Chinese people been hiding things, because this says that they had researchers who became ill from viral infection long before they ever reported the actual coronavirus infection, which makes them believe that they aren't telling the whole story, which I think most people believe that anyway. Now, there was a number of articles on this subject, all indicating that it is well known that in Wuhan, China, they were working on virus infection from bats that had infected people, and they were working on these bat viruses in Wuhan. And so the question was, did those people working on the virus release the virus to the world? And so the fact that they didn't release any information until December, these people had the problem in November, leads people to believe that they're not telling the whole story. So there has been more and more questions about. I remember Trump said something about this, implying that WHO, the World Health Organization, had not gotten the whole story on the coronavirus. And it now appears that this may well be the case. But it still says that it's coming from the bat, not from anything else. It's still is a zoonosis, which is the virus infection that comes from another species. So in this case, the species is the bat.
Dr. Callender, we talked about this issue before, about what viruses can be transferred from animals to man. And this was one of them. I think there were maybe one or two others.
Oh, many of them. There are many of them. Most of the viruses that we have are coming from other species. It's just that they haven't caused huge diseases like coronavirus and the flu. But those are examples of zoonosis, is the term they use to call the infection you get from other species that come to humans.
Are you talking of things like malaria?
No, well, yeah, malaria is come from another species, yeah. But I was thinking of the viruses. That it's not a virus. But yeah, there are other diseases that come from other species and infect us.
They said that, did they say that AIDS was one of them?
Absolutely. And yeah, AIDS is one of them from the primate model. From the primate model, they think somebody ate one of those primate, and that's how we got it.
Oh my goodness.
Yeah. From Africa, yeah. Yeah, so there's a lot of evidence that HIV is one of the most dramatic manifestations of zoonosis.
Mm.
I'm not trying to defend China, but I'm just wondering if we had people experimenting here at, say, NIH, and maybe 2 of our scientists got sick, 2 or 3 got sick, and I don't know that they knew right away what they got sick from. But if 2 or 3 of our scientists got sick, would we report it that same day or same week? They only waited a month or less than a month before they reported it. Is that really an unusual thing or not?
Well, I think the point is that when you know it, that's when you should report. Whenever you know it, because what you should do then is immediately isolate those people. And so they didn't do that until later on. So I think that the question is, whenever you know it, that's when you should do it. So if they knew it, or if they didn't know it, then it's not a problem. But if they knew it, then it would be it.
Okay, okay. Yeah, I just wondered because a month just didn't seem like a whole lot of time, but I'm sure with the virus it is, but if they didn't know right away, but you know.
Yeah, that's the question, and I don't know. We don't know the answer yet. There's a lot of talk about it. And when it first came out, the Chinese people were not releasing the information. So now
We're
they,
skeptical about China anyway, so
well, that's right.
yeah. Okay.
And in Russia the same way. Yeah. Now, there's no question now that even if you had COVID, you need to get vaccinated. So, but there's Rand Paul. I don't know who Rand Paul is. He was an ophthalmologist. He's a lawmaker now.
He's a senator from Kentucky.
Right. And so that was his decision to take. So, but most scientists do not agree with him. They think that we should get vaccinated anyway.
And he's a Republican.
Yeah. Yeah.
But he was one of the first Congress people to get COVID. You know, so he should know it's not a joke. That's for real, and it's not a fake. It's not a hoax. It's real. He got it, but yet he's now grilling Fauci about them funding viral research in China, in that lab where they say the research is being done on COVID.
Right. Yeah, yeah. Although I think that's pretty accurate, what you said.
The question is a Republican a disease? Being a Republican a disease?
No, it's not a disease.
Dr. Callender, when he talks about natural immunity, I mean, I thought there was no information that once you've been vaccinated, you still probably could get the virus again. I mean,
we don't know the answer to that. I think all we know is that if you get vaccinated, you're more likely to have a lot more antibodies and sensitized T cells that prevent you from getting infected. We don't know the answer to is natural immunity enough? We don't know the answer yet. And that's so, Paul, it may turn out that he doesn't need any more vaccinations. It's just that because we don't know, we think the best thing to do is to give the vaccination. So it may turn out that Paul is adequately immunized. I don't know. And the other thing is we don't know how long the immunity lasts, and from natural immunity or other immunity. So because of the lack of information, it was thought that it would be best to vaccinate people who already had COVID.
You know, Dr. Callender, that was a good question because it's very weird because some of the other vaccinations that we take, they give us a lifelong immunity.
Some do and some don't. That's good. For the flu, we don't. Right. For the flu, we have to take boosters every year. But others, you're right.
Yeah.
It will last decades. And some.
Also, there's a scary thing that it's not one flu vaccine. Every year, the vaccine changes because the flu mutates and different versions are, and they have to roll the dice as to which version is going to be more popular that year. So it's going to be different every year. I'm wondering if COVID is going to be different every year. You already have 3 or 4 different variants out there now. You know, so once they decide to give a booster shot, whether what that shot is going to look like every year.
Well, what we have to do is wait for the studies on the first vaccine clinical trial patients, which will be about a year in July, and see what the tests on their antibodies to see whether they have lasting antibodies or not. And based upon what we see from them, we'll have a better answer as to whether we'll need a booster shot or not. But we don't know yet, but we'll know soon.
Yeah, well, I remember when we were first getting the flu shot, everything was okay. And then all of a sudden I heard that one year we had to get a double dose. To John's point. Yeah, we had to
Double dose is only for older people.
Repeat that, please.
Double dose is only for older people.
Oh, is that why I was concerned?
Yeah, because your immunity wanes as you get older. And over 65, you need a double dose.
Oh, okay. It wasn't because the flu got worse or anything.
No, it was because you get older and your immunity level goes down.
Because we got worse, John.
Yeah. If you think older is worse, yeah, you're right.
It just got less, whatever. Yeah, so.
Well, a lot of times people say, I'm not getting older, I'm getting better.
Well, you may be getting better, but your immune system is getting weaker.
Yeah. Only somewhat better.
I'm getting wiser.
Yeah.
Okay.
Yeah.
You're wiser to your immune system that's weakening.
Yeah. Yeah. Okay. Now the issue that still remains unaddressed is what happens with transplant patients. That's an issue that still remains to be seen.
I think we had an article last week on that. Let me see if I can. I'm going to stop the share and I'm going to go see if I can find that article about transplants.
Yeah, what it says is that basically we have the tests that were done. I think John Tatum actually predicted that the data would show that transplant patients immunity is weakened, therefore they would probably require higher doses. And the test that came out of Johns Hopkins indicated that he was right, that transplant patients are on medications that does in fact weaken their immune system and mean that they do not have the same high antibody titers that people who are not immunosuppressed have. And so for that reason, we don't know exactly to what extent. It appears likely that transplant patients would require additional vaccine doses. So yeah, this is based upon that article that you see here, that the antibody titer. Now, this doesn't tell you so much about the ability of the white blood cells, because immunity is brought about by antibodies plus sensitized T cells working together to prevent infection. And all this test does is study the antibodies. Okay, and we know that the amount of antibodies is much less in transplant patients. And so it appears as though that the transplant recipients would require additional doses. Now that has not been worked out, but what John Tatum had predicted did bear out.
Yeah, well, also, even though I suspected most of this, the other issue is how the vaccine reacts with steroids.
Well, that's what it's all about. That's what immunosuppression, most of the immunosuppression is steroids, plus other medications. But for the most part, you're talking about the immune reduction because of the steroids, prednisone, and other regimens, especially prednisone. And I think what is likely is that we will learn that you may have to do a double dose for transplant patients because of their taking immunosuppressive medication.
So since John mentioned steroids, what about people who maybe have gotten steroid shots because of pain in their knees or backs or something for years?
That's not going to cause suppression because you only get 1 or 2 shots. And we're talking about people who are taking prednisone every day.
Okay. That's all I needed to know.
So you wouldn't need to worry about 1 or 2 shots. But that goes in and goes out quickly. But
Dr. Callender, explain this thing that I've been hearing just recently on TV about the mono whatever antibodies.
Oh, your monoclonal antibodies is the treatment for COVID. And you remember, now I think you all remember because you accused the president and Ben Carson of getting special treatment.
Right.
They went to Walter Reed and they got monoclonal antibodies that cured the disease, as a matter of fact. It was both of them. And so that treatment is available. But because the vaccine is preventing the disease, many people who get the disease, you don't hear much about monoclonal antibodies. But they are effective at treating coronavirus, as is in some cases salumedrol type of methylprednisolone, which is also effective.
Oh, okay. I thought it was something new. Yeah.
Well, no, it's not new. It's not new. It's just that because the vaccine, there's been less attention directed to the monoclonal antibodies. But they're the same antibodies that Ben Carson and the president, which we talked about that many of us didn't get.
Okay, thank you.
This is an interesting article because people, when they talk, what we don't talk about is the people who have cancer and have chemotherapy, which knocks out the immune system as well. And so these people are in the same category as transplant patients. And what is not resolved is now that you find out you don't have enough antibodies, what do you do about it? And they haven't decided what to do about that, and they're working on that because they're doing special vaccine tests on the immunosuppressed patient, which they did not do before.
Dr. Callender, they have been, I'm asking, they have been working on that for a while because they have been working, even before COVID came out, they were working on ways to try to reduce the medication that transplant patients needed.
Well, yeah, because the goal is to have immune tolerance, which means you don't have to take medications every day of your life. We have not been able to accomplish that yet. Still working. There's some research projects that are in process that are hopeful in terms of getting to the point where we don't need to take any more medication. But there are ways can be completed. So it's going to be interesting. But what they are doing now, though, is that the initial test, they did not use transplant patients, but they're doing vaccinations now, specifically on transplant patients and patients who have immunodeficiency states to see how to overcome that. But we don't know the answer yet. There's a hope that you may have to have a booster or a double dose for the transplant patient. But we don't know the answer yet. And this talks about the T cell may be there to take over where the antibody doesn't. And so if you have a strong T cell, that's maybe that'll help. We don't know the answer to that. That's really speculation. The HIV community is different in a way because those people who have normal white counts may have a relatively normal immune system, whereas those people who have low white counts are not still have the virus in a different category. So that's still an area that needs more study.
Dr. Callender, when you say immunosuppressant, does that include multiple sclerosis patients?
Only if they're given medication. Only if they're medicated. I mean, people who are given medication, like prednisone and those kind of drugs. Anybody on those drugs would be immunosuppressed. Multiple sclerosis itself, and we don't think renders you immunosuppressed. But sometimes people are treated with prednisone because they have multiple sclerosis. And they would then be immunocompromised. So while we know a lot, there's a lot we don't know. Now, what this does mean is that there was an article in the Post, a 3-page article in the Post about people who don't know whether they should wear a mask or not because they've had a transplant and this lady's talking about. And so they don't know whether they should stop wearing a mask or not because they don't know if they're sufficiently immunosuppressed or sufficiently vaccinated to go around without a mask. So this mask or no mask has caused a lot of confusion for a number of people. And so they could have been very critical of Biden for not clarifying it more. Well, the CDC actually released a report, not Biden. But anyway, so this is an issue.
Dr. Callender, let me ask a question about people who have sickle cell disease.
Oh, yeah, that's a good one.
Yeah, just like you were talking about multiple sclerosis.
They're not immunosuppressed.
The question is, how does the vaccine and coronavirus affect them differently?
Well, now the vaccine would affect them the same way it affects everybody else.
Mm-hmm.
I don't know any, I haven't read any reports on coronavirus in patients with sickle cell disease. So I can't answer you on that. I can just say that they're not immunosuppressed, so they would be vaccinated with the expectation they would be like other normal people. Because their immunity is not affected. Their sickle cells are affected.
So sickle cell people don't have to take medicine per se?
Some of them do, but it's not, doesn't knock out the immune system. It just acts on the red cells.
Okay.
Now, this we all know that
Oh, yeah.
this exposed, the COVID virus exposed racism. And as we cure the virus, we need to also cure institutionalized racism. So, but the question is, are we addressing institutionalized racism? We're addressing COVID, but I'm not sure that we're addressing institutionalized racism. And that's the problem that needs to be addressed simultaneously, but is not.
So you believe that the issue that we have here in DC with the African Americans has more to do with the African Americans' refusal to take the vaccine?
Some would call it reluctance.
Reluctance, okay.
Or hesitance.
You said from 40% to 70%.
40% to 80%.
Mm-hmm.
Okay.
Before we go, this has nothing to do with anything we have discussed, but Dr. Callan, I love that picture on your wall. Is that?
Oh, with the, yeah, thank you.
That is beautiful. Is that you as a young man? Or
No. Nice concept of the guy taking care of his son.
Yeah, the other thing, Dr. Callender, I wanted to mention to the group is that guy from the radio station that came up here one time. His name is Rob Sims, from PW radio station. He came one time and asked 1,000 questions about getting a kidney transplant. Well, he got one.
Oh, great.
And I announced that earlier, but the sad announcement today is that he died.
Oh.
Oh man.
How long ago was that?
2 weeks ago. His funeral, the transplant, Carol, let's see, the transplant was, I would say about 2 months ago, 2 or 3 months ago. 3 months ago, he got a kidney transplant. And I came back and I announced to everybody, and everybody said, well, tell him to come back. Tell him to come back to the group to let us know how he's doing and everything. But he never did get around to coming back to us. But they don't really know how he died. And that's the mystery about everything, because, you know, he qualified for the kidney transplant. So any underlying issues that he had must have been either resolved or at bay or something. But he, you know, he was on dialysis, he had diabetes and some other things, but he had everything under control. They gave him the kidney, and his heart, they just really don't know how he died. Just conked out.
Sorry to hear that. Okay, so next week I'm going to send you the psychologist's email address so you can send them an invitation.
Okay.
She is going to talk to us about the initiative that she has in the school that helps students with mental illness issues.
Okay. And are we going to have a group session this coming Tuesday for the application?
June the 7th.
Okay.
June the 7th.
Okay. All right.
And what time did we say it was? June the 7th?
I think 1 o'clock.
1 o'clock?
1 o'clock.
Yeah, 1 o'clock.
Okay.
And one report, how is John Robinson doing?
He says he's going to go to hospice, but I thought he was already on hospice. But anyway, he says he's going to go to hospice soon. He's back in the hospital again.
Mm-hmm.
But I saw a picture of him. He's greeting another person, and he seemed to be in good spirits. But he's had at least 6 hospitalizations in the last year.
Mhm.
And the fact that he's going next to hospice kind of says it all.
Okay.
It's his heart. His heart is his. So keep him in prayer.
Okay.
Joyce, are you back?
Yes, I'm back.
Welcome.
Thank you. Good.
Welcome
It's
home.
good to be back.
Mhm.
Good to have you back. Yeah. Okay. Well, we look forward to seeing you next week. We'll have some news for you next week too. Special news.
Hey,
Yeah,
Charles.
happy Memorial Day weekend, everybody.
Thank
Yes,
you.
yes, sir.
Same to
Yes, to you.
Sunday, Sunday
Tell
is
Carol
my
to call me.
sorry.
What is it?
Sunday is my 17th wedding anniversary, which
Oh.
coincides with the cicada. act.
That's right.
Congratulations.
Yes.
So
Celebrate.
you know,
Celebrate.
for 10
You
years you
deserve
get
it.
gold. For 17 you get cicadas.
Don't eat any.
Mr. Buchanan. Mr. Buchanan. My husband told me to ask you if you knew a teacher at Kelly Miller named Kathleen Criswell.
Cresswell, yes. She was a wonderful woman. I just found out that she had passed.
Yeah, her
And,
funeral services are this coming Saturday.
Yeah. She was great. She was a great lady.
That's one of my husband's ex-girlfriends.
Oh,
He has me asking about.
well, I don't blame him. She was a wonderful woman. Wonderful. She was great. Always positive and very smart. Very smart.
Thank you. Birds of a feather flock together.
Did you hear that?
Okay. All right.
Thank you. Thank you, Dr.
Thank you, Dr. Callender.
All righty. Thank
you so
you.
much.
Carol, call me, please. Carol Tatum. This is Betty.
Okay.
Thank you.
Okay.
Uh-huh.
Bye-bye, everybody. Be safe.
Bye-bye.
See you next week.
Bye.
Bye-bye.
Right.
Bye-bye. That's giant.